if a man suffering from diabetes, the diabetes will impact on sex life.
There are nerve damage, the vascular damage, so they will have erectile dysfunction because of less blood flow to the organ during the sexual act.
Sir, name some natural foods that can increase the testosterone level.
All the nuts, dark chocolate, even garlic, onion, those can increase the testosterone levels.
Okay. Sir, you are associated with Veer. So what is Veer, sir?
So we take care of men's sexual health and problems related to male sex.
Hello Naveen sir, welcome to Socialpost. Sir, can stress reduce the sperm count?
Stress, if it is chronic and persistent,
Okay.
can lead to oxidative stress in the sperm, and that can damage the DNA,
Okay.
and that can reduce the motility and morphology of the sperms.
Okay.
So overall, stress will affect sperm quality, and also stress can affect the sexual performance.
Okay.
Anxiety and stress can lead to erectile dysfunction and premature ejaculation.
Okay.
So both erectile dysfunction and sperm quality, the stress has effect on. So overall, chronic stress, if it is persistent, it can lead to erectile dysfunction and problems in conception.
Can it is really impact immediately? It will be on impacts answer, sir.
The stress will not have impact on
Sperm
sperm
count.
morphology or sperm quality. It is a chronic stress which affects the DNA of the sperms. So immediate stress can affect the sexual performance. Immediate stress can lead to premature ejaculation. Immediate stress can lead to inadequate erection. But long-term stress is the one which leads to sperm quality, damage of the sperm quality.
So if a man suffering from diabetes, so the diabetes will impact on sex life.
Diabetes has, in the multiple ways, it affects sex life. First, diabetes, especially it is a diabetes type 2,
Type
will have
2.
insulin resistance. They will have a certain some kind of metabolic syndrome where the lipid profile is changed. There are nerve damage, the vascular damage. So they will have erectile dysfunction because of less blood flow to the organ during the sexual act. Also, the nerve damage also will cause ill-sustained and weak erections. So diabetes can cause hormonal changes. Diabetes 2, long-term diabetes can cause hormonal changes, and which in turn will lead to erectile dysfunction.
And when it is become more dangerous, sir?
The diabetes.
Yes.
Diabetes as such, if it affects the performance of the man,
Okay.
that means the vasculature is damaged. Now, I'm just giving you an example. The vasculature of the penis is around 3 to 4 mm in size. So,
Okay.
vasculature of the penis is damaged. That means 3 to 4 mm blood vessels are damaged. So, erectile dysfunction is a sign, alarming sign that in future you will have major vascular catastrophe like heart attacks and brain hemorrhage. So, if the erectile dysfunction happens, that means in 3 to 5 years, the same disorder which affects the vascularity of the penis will affect the vascularity of the heart and the brain. So, is a danger in that is an alarming sign that a person with the diabetes, person with a metabolic syndrome has erectile dysfunction, that in future he may have catastrophic events leading to heart or brain.
Sir, when a person is addicted to smoking and drinking, so what it will be caused in his sex life?
The smoking will lead to damage the DNA.
Damage the DNA, okay.
It increases the oxidative stress
Okay.
in the sperm, and so the sperm quality, sperm morphology will come down. So smoking will affect the sperm quality, the sperm morphology, and it will damage the sperm DNAs also. Also, if it's smoking, can directly lead to vascular damage. The smoking can lead to damage to the epithelium, the vasculature. So it can cause ill-sustained and weak erections. It can cause damage to sperm DNA, so difficulty in conception. And also, the smoking will have some psychosomatic disorders also. If a chronic smoker will have psychosomatic disorders like anxiety and depression, and this can also lead to premature ejaculation, low libido. Low libido means the interest in sexual act will be low. So it can affect libido, it can affect the interest in sexual act, it can affect the sexual performance, also it can affect the quality of the sperm.
Okay.
So it can affect in multiple areas in male reproductive system.
So when somebody, I mean, when in Insta scroll, in Insta videos, Insta reels, I have seen some videos that a normal, a layman can drink alcohol, but I mean, limited occasionally, so it will not affect his sex life. Is it true, sir?
The alcohol is known to cause immediate, there will be some improvement in the interest.
Okay.
So when you take alcohol, you will have a boost in your overall performance because your interest will increase. But long term, the performance will be affected.
Okay.
So alcohol will have initial increase in libido when you take in limited quantity, and that is immediate. But long term alcohol intake will cause a lot of hormonal changes in the body, and it will cause erectile dysfunction.
Okay, sir. And next, and welcome to the drugs addiction. So when somebody having a drug, like ganja or something else in his smoking, so it stamina will be decreased or increases, sir?
No, but if the drug addiction is there, they will definitely will have erectile dysfunction. The stamina, the ability to maintain the erection for long term will go.
Okay.
Most of the drug addicts, if they take cannabis, you're talking about ganja, it's a cannabis.
Yes, example,
the
ganja.
cannabis will have psychosomatic disorders.
Okay.
The people who take it for longer term will have psychosomatic disorder. That will affect libido and also performance in long term.
Performance also.
Long term.
Then how can he recover, sir, from that?
Rehabilitation. He has to join some rehabilitation, take help of the psychiatrist.
Okay.
Engage in other modes of the life where he can de-addict from the cannabis and ganja or smoking.
Okay. So, sir, some steroids is there in gym or something else. So that steroids will affect in our sexual life, sir.
The steroids what we take in gym will increase the testosterone in the body.
Okay.
So that will help a person to get a masculine body. So it is very commonly available. People take it. There's a fad of taking the anabolic steroids. They are called anabolic steroids. They will improve. They will give so-called V chest, the broad chest, and it gives a V chest, and that helps increase the libido initially. But what happens if you take anabolic steroids from outside, the body, it sends a negative signal to the body, and body will stop producing the own anabolic steroids. And once testosterone production of the body will go down, long term, they will have defective sperms. The sperm count can even become zero.
Okay.
I have seen so many people who go to gym, the sperm count will become zero if they go on taking anabolic steroids.
Okay.
And because of the low testosterone production, because of the extrinsic intake of testosterone, will reduce the sperm count, which is the testosterone, which is produced by body. So in future, it will cause a sexual problem. It will cause low sperm count or even zero sperm count.
Even zero sperm.
Yeah.
Sir, when a man's semen analysis looks like normal in report, but why conception was not happening?
The conception needs first deposition of the sperm in deep into vagina. We call it as a posterior fornix of the vagina.
Okay.
So any act where this deposition of sperm is not happening, suppose patient is not getting erection, so he is not able to deposit the sperm, or he has some problem, anatomical defects, where the sperms are not directed in the vagina, but it is leaking outside, or premature ejaculation where the sperms are not being deposited.
Okay.
These are common factors where the sperm quality is okay, sperm looks okay, but still they are not able to conceive. Or second thing is that apart from female infertility, if you don't consider female factor, then the second factor is if the sperm has sperm DNA damage. So we have to do certain test, advanced test, to know whether there's a DNA damage or not. So overall, the sperm quality may look normal, but they will not be able to conceive if there is DNA is fragmented, DNA is damaged.
Okay, sir, what health risk may increase for the baby when his father becomes after age in 40?
If the late fatherhood, the father is beyond 40, there's small chance of increase in risk of autism or low birth weight or psychological disorders like bipolar disorder.
Okay.
But the risk is not very high. It is more of it is linked to the female age rather than male age. But advanced male age can affect in a smaller way, not in a higher way.
Sir, how significantly when emotional stress can damage of sperm count, sir?
The emotional stress, if it is persistent, will definitely cause change in hormonal levels in the body.
Example.
So there is some kind of fight and flight response.
Okay.
When you have lot of emotional anxiety, either you fight or you fly. There's a flight. So in that, cortisol level increases. If the cortisol goes up, that will damage the testosterone levels in the body. So when there is a persistent anxiety or persistent emotional stress, will lead to increase in cortisol, decrease in testosterone hormones. So low performance, erections will be weak and ill sustained.
Okay. Sir, name some natural foods that can increase the testosterone level.
Foods.
Yes.
There are certain foods which will boost testosterone levels to certain extent.
Okay.
Like dark green leafy vegetables, all the nuts, dark chocolate, even garlic, onion. Those can increase the testosterone levels.
Okay. Can we take Shilajit like some sort of like?
Shilajit is more of a Ayurvedic medicine. I'm not a great expert to comment on Shilajit, but yes, it does work in increasing the stamina and the interest in the person who's taking it.
Sir, what is the important truth about male fertility? Most of the men hesitate to accept it.
Nowadays, there is increased in awareness about infertility because of social media.
Okay.
Many people know. But previously, or even in rural areas, people think that females are the only ones who are responsible for infertility. But if you see actually the data, the 30% cases it's a male, 30% cases are females, and rest of the cases both male and female. That means both of them are equally contributing to the problem of fertility. So that is something most of the men are not ready to accept, that male also have a role to play in infertility.
Okay.
So when infertility appears in a couple, the both of them should take the consultation of the experts and go and consult to the relevant doctors. So that is an important thing, and for that awareness should be increased amongst the
Awareness
couples.
should be increased.
When we give advice to the men in a couple that if you want to conceive, don't drink alcohol or don't eat junk foods or take these medications or leave smoking, they think no, it's okay, I'm a man. So it is more important for females to follow all these things. A man can do whatever he can because he just has to contribute the sperms. But all these factors also greatly affect the sperm quality and sperm morphology and sperm quality. So both the partners should follow the advice, and both the partners should seek the consultation from the doctors.
What are the precautions should we take when testosterone has to be increased for men?
Testosterone, there are certain foods, as I told, which
Yes.
increases testosterone. To repeat, protein-rich food like eggs, the nuts, the pumpkin seeds, dark green leafy vegetables,
Okay.
oysters. This can increase testosterone level. Also, if the physical activity,
Okay.
if we do 45 minutes of physical activity daily,
Daily.
then it will boost the hormone levels.
Okay.
Also, the mind should be calm. If the mind is restless, the hormones will go down.
Okay.
So engaging in yoga, meditation, mindfulness will help to increase or to maintain the hormone levels.
Okay.
And if all these fail, then probably supplementation of testosterone is needed from a doctor.
Sir, how do you treat erectile dysfunction?
Erectile dysfunction, in 50% of the cases, it is because of the psychological, and rest of the 50 it's because of some pathological factors in the body.
Okay.
In psychological factors, we take in help of the psychologist who will do counselings, of the couple counseling, which is more important, behavior therapy, and help the patient to come out of the psychological issues and get rid of the erectile dysfunction. In pathological factor, we find out what are the causative factors leading to erectile dysfunction.
Okay.
So there are modifiable factors like obesity, smoking, alcoholism, drugs, addiction to the drugs, or apart from that, certain medication can improve reduce the performance. So we take care of these factors and try to modify these factors, where we can ask the patient to leave smoking, improve the patient's diabetic glycemic index, we improve it. So take care of the modifier factors. And even after this, then we start treating the patient first with the medical line of management. You routinely used medication like PD5 inhibitors.
Okay.
So we use them. My experience has been giving continuous administration of PD5 inhibitor like Viagra, Tadalafil, which are available in market, helps the patient to get cured. Many patients use it as a blue pill they take whenever it is needed. The single intake may improve the performance on that day, but if you stop it, again the patient's erectile dysfunction comes back. So with my experience, if you want to cure, it's better to take low dose, continuous administration of the PD5 inhibitors over a period of 3 to 6 months.
Okay.
Whether you perform or don't perform, you go on taking these medications. It helps in curing the problem. So rather than taking it once in a while, take it continuously if you face the erectile dysfunction in a low dose. That helps to cure the problem. Then if the patient do not respond to medications, and if we check the hormone levels also, the hormonal levels, although we supplement hormones, after treating with hormones and treating with medication, if patient doesn't respond, then we go for something called electromagnetic therapy. We use stem cells along with electromagnetic therapy on the penis. We give it once in a week shot for 6 weeks. And 70 to 80% people do respond to this kind of therapy when they fail with the PD5 inhibitors medicine. And there are some subset of the patient who do not respond to both.
Okay.
They do not respond to medication. They do not respond to electromagnetic therapy. In that, we go for a penile implant. So it's a surgical intervention where we put a silicone rod inside the penis and which gives erection to the penis, which is aided with a siliconized implant which is put in the corpora of the penis.
So, sir, what is the role of penile implantation?
Penile implant is for people whose erections the erections are so damaged that even with the medication or even with the electromagnetic therapy, they don't show any response. When we do penile Doppler, we do ultrasound study of the penis, the vasculature is very much damaged. So in that case, we don't have any medications, we don't have any other treatment, then we finally have to resort to implantation of the siliconized rods. The penile implant is a surgery where there are 2 rods in the penis, which are natural. And these rods are filled with the blood. When a person gets aroused, the blood will flow in those rods and the penis becomes erect. Okay. So it is a purely vascular phenomenon. Suppose there is a damage to the vasculature, whatever medicine it takes, whatever therapies it takes, the blood will not flow. In that case, we replace the blood with the siliconized rod. Okay. So there are multiple rods available. There's some simple rod and some highly technically difficult implantation rods also. So we can put those rods which gives artificial rigidity to the penis. So patient will not depend on blood influx into the penis. These rods will work as a support to the corpora and they will be able to perform the sex.
Sir, are people aware of this procedure, sir?
The awareness is not much because most of the people they go to the non-qualified doctors. Okay. They take treatment directly from the counter. They take help of many herbal medications. They go on trying and sometimes they will give up. Okay. Thinking that. And they are not being advised that there are certain treatment things like penile implant exist. So penile implantation is a sure shot success. Most of the patients do respond positively. Okay. And in long term, both the partners, husband and wife, and the partners are happy with the penile implantation. And when it is needed, it is the best kind of treatment. It gives 100% success rate over a longer period of time. So, but the problem is awareness. So awareness is not there, and most of the doctors, even the doctors, don't know that this kind of treatment exists.
Sir, you were associated with Veer. So what is Veer, sir?
We have founded Veer concept where we take care of male health. Okay. Men's health, not only about sexual health, but even certain diseases which are unique to male.
Example?
Like the prostate, the prostatic problems,
Mm.
and the second is sexual problems, aging problems, so-called andropause. So we take care of men's sexual health and problems related to male sex.
Okay.
We have founded this clinic, and we have a urologist, we have a psychosexual counselor,
Okay.
we have a cardiologist who will take care of vascular health, and we have a yoga and nutritionist who will give a lifestyle changes and yoga. All these things do contribute to healthy life.
Okay.
So it's a team effort, and with as a team we treat men's health problem.
Okay. So thank you, sir, for coming on Social Post.
Thank you so much.